US fertility rate hits record low. What's behind the decline? CDC data analysis. The latest news on the US fertility rate might come as a surprise to many. It's plummeted to a historic low, according to the US Centers for Disease Control and Prevention (CDC). This decline isn't new. It's been a gradual descent for almost 2 decades now, but here's where it gets controversial. Some experts believe economic pressures are largely to blame. Leslie Root, a fertility and population policy researcher from the University of Colorado Boulder, explained the situation to the Associated Press, saying, "We're observing this as part of an ongoing trend where people are delaying having children. Despite this, the overall US population is still increasing because there are still more births than deaths. Historically, the fertility rate in the US has seen its ups and downs. It peaked at around 3.5 children per woman in the early 1960s, dipped to 1.7 in 1976, and recovered to 2.1 in 2007. Today, it stands at 1.6 children per woman, aligning the US with many Western European countries in terms of fertility rates. What drives these fluctuations? A multitude of factors, primarily economic stability and the cost of living. For instance, housing affordability is a significant concern for many families. Karen Guzzo, director of the Carolina Population Center at the University of North Carolina, highlighted the mental toll of worrying about finances when considering starting a family. Worry is not a conducive environment for having children. This drop in fertility rates has caught the attention of policymakers. Some lawmakers are advocating for government intervention to boost birth rates, suggesting policies that encourage childbearing and support families. During his presidency, Donald Trump even took steps to make in vitro fertilization more accessible through executive orders and referred to himself as the fertility president at a Women's History Month event. However, the administration also made cuts to essential social programs that could provide financial security to families. These budget reductions extend to medical research aimed at improving fertility treatments. Guzzo summed up the situation succinctly. These actions are more symbolic than substantive. They won't significantly impact real Americans' lives. So, what does the future hold? Will economic conditions improve enough to reverse this trend? And should governments play a larger role in encouraging higher birth rates? These are questions worth pondering as we navigate this evolving landscape. What do you think? Share your thoughts in the comments below. US birth rate hits all-time low. What's behind the decline? The US birth rate has hit an all-time low. What's behind the decline? The latest data from the Centers for Disease Control and Prevention, CDC, has revealed a shocking truth. The US birth rate has plummeted to an all-time low. With fewer than 1.6 children being born per woman in 2024, the country's fertility rate has reached a historic low. But what's driving this decline? And what does it mean for the future of America? A shift in fertility trends. The US was once among a few developed countries with a fertility rate that ensured each generation had enough children to replace itself. About 2.1 kids per woman. However, this rate has been steadily declining over the past 2 decades, with more women waiting longer to have children or choosing not to have them at all. In fact, the US fertility rate is now on par with those in Western European countries, according to World Bank data. The Trump administration's response. In response to the declining birth rate, the Trump administration has taken steps to encourage more couples to have children. In February, the administration issued an executive order aimed at expanding access to and reducing the costs of in vitro fertilization, IVF. The order also backed the idea of baby bonuses to incentivize couples to have more children. However, some experts argue that these measures don't address the underlying issues driving the decline in birth rates. The real reasons behind the decline. So what's really behind the decline in birth rates? According to Leslie Root, a researcher at the University of Colorado Boulder, it's all about fertility delay. We're seeing this as part of an ongoing process of fertility delay, she says. We know that the US population is still growing and we still have a natural increase, more births than deaths. In other words, the decline in birth rates is not necessarily baby bonus. US fertility rate hits record low amid IVF push. Imagine a scenario where the number of babies being born in the United States has dropped to its lowest point ever recorded. According to the latest data from the Centers for Disease Control and Prevention, CDC, released on Thursday, the US fertility rate in 2024 stands at just under 1.6 children per woman. This figure is significantly below the replacement level of 2.1, which is the rate needed to maintain a stable population without immigration. The current rate is now comparable to that of many Western European countries, marking the continuation of a steady decline that has been ongoing for nearly 2 decades. Back in 2007, the US was one of the few developed nations with a fertility rate at the replacement level. However, this has changed as more women are choosing to delay having children or opt out of parenthood altogether. Baby bonus initiatives. In response to this alarming trend, the Trump administration has introduced several measures to encourage higher birth rates. These include an executive order to expand access to in vitro fertilization, IVF, and the proposal of baby bonuses, financial incentives designed to motivate couples to have more children. Despite these efforts, experts remain skeptical about their effectiveness. Karen Guzzo, the director of the Carolina Population Center, told NBC News, "We are seeing a general decline in birth rates across most age groups, and it's unlikely that this trend will reverse anytime soon." Guzzo also pointed out that many people are delaying marriage and expressing concerns about their ability to afford raising children. A closer look at the numbers. While the fertility rate is at a historic low, the total number of births in 2024 actually saw a slight increase of about 33,000. However, when adjusted for updated census estimates, the overall birth rate still showed a decline. The CDC noted that the recalculated data revealed no significant changes in birth rates for women in their late 30s, but a noticeable decrease for those in their 20s and early 30s. Is there cause for concern? Despite the low fertility rate, some experts argue that there's no immediate reason to panic. Leslie Root, a researcher at the University of Colorado, explained that the US population continues to grow, albeit at a slower pace. "We still have a natural increase with more births than deaths," she said. This suggests that the decline in fertility rates is part of a broader trend of delayed childbirth rather than a catastrophic drop in population growth. Controversial measures and public opinion. But here's where it gets controversial. The idea of using financial incentives to boost birth rates is not without its critics. Some argue that such measures could lead to unintended consequences, such as increased pressure on families to have more children regardless of their personal circumstances. Others believe that addressing the underlying economic and social issues, such as the high cost of living and lack of affordable childcare, would be a more effective long-term solution. What do you think? Should the government focus on financial incentives, or are there better ways to support families and encourage higher birth rates?